Hello, everyone. Welcome to the webinar entitled Helping Youth Succeed, What Vermont Can Learn from Iceland's Approach to Prevention. This event is brought to you by Prevention Works Vermont under funding from the Department of Health Office of Alcohol and Drug Abuse Programs. Thank you. My name is Eric Jones, Marketing and Technology Specialist at the Center for Health and Learning, and I will be supporting the webinar today. Thank you all for joining us for this opportunity to share innovative models in prevention. I am pleased to introduce the presenters to you. Jeannie Burley is the prevention educator with Central Vermont New Directions Coalition, a nonprofit organization dedicated to making a difference in youth substance use in our community. In addition, she is part of the steering committee at Prevention Works Vermont, whose mission is to connect and unite coalitions across Vermont to support long-term solutions that engage the entire community to create safer and healthier communities for everyone to succeed. She is also a board member of the Vermont After School Board of Directors. Holly Morehouse is Executive Director of Vermont After School, where she brings over 15 years of experience in project management, community-based decision-making, communication and collaboration processes, and leadership. Her research and publications include work on after-school programs and school culture change, shared vision models for community-based decision-making, and the spatial mapping of indicators for risk and vulnerability. Dr. Morehouse is the recipient of the 2017 Con Hagen Award, given to a leader who shows deep community involvement, generosity, enthusiasm, a collaborative approach, and a focus on data and outcomes, and also received the Kids Count Award from Voices for Vermont's Children for her advocacy to ensure low-income students across the state have access to quality after-school and summer programs. Joellen Torello is Executive Director of the Center for Health and Learning, a 501c3 that brings capacity to initiatives that address priority health issues. She is a state and nationally licensed health educator and has a passion for wellness promotion and expertise in a variety of personal health topics, including mental health, suicide prevention, bullying and harassment, HIV prevention, and sexual health. Under her leadership, CHL has overseen numerous practice involvement initiatives and offered training to and TA to over 24,000 people. She is the author of Walk Smart, Bike Smart Vermont, and producer of Bike Smart on-bike curriculum, and developer of the You Matter Suicide Prevention Program, which received designation as a National Best Practice Program. In 2012, she received the Distinguished Service Award from the Vermont Association of Physical Health Education, Recreation, and Dance, and in 2014, a Fellow Award from the American School Health Association. She was recognized as a Vermont Prevention Champion in 2017. We welcome all of these presenters. Without further ado, I will pass the presentation to Ginny Burley.
Hello, everyone. I'm going to introduce you to the content of the webinar. And it started when Holly Morehouse from Vermont After School won the Con Hogan Award 2 years ago. And she knew exactly what she wanted to do with the rather generous stipend. She wanted to find out what was going on in Scandinavia that made them so successful in positive youth development and prevention. She made a couple of trips to Iceland and Finland, and spread the word around the after school and prevention community. And when there was an opportunity to go to a workshop in Reykjavik that was all about the Iceland model, 10 people from Vermont made the trip from very different domains, and we learned a lot. We sandwiched the content of the workshop in between sitting in frozen fields waiting to see the northern lights and checking out the incredible geothermal systems that generate so much electricity that they have extra to pipe under parking lots, and they don't plow anything. It also heats the entire country. And we looked at black sand beaches, and we learned a lot, and we're here to share it with you. One of the members of our team was Judge Ben Joseph, a retired judge and legislator, and he has this beautiful description of the landscape. He says when you drive along the seaside roads, you see glaciers that have formed in the mountains and are making their way to the sea. You can see geysers of steam rising up through vents in the earth where water from the melting snow has met the red-hot lava below the surface. He also points out that the most important aspect of their program is that they are determined to spend whatever it takes to keep young people away from alcohol. And the purpose of the program is to create an organized system for incrementally improving the social environment over time. And I think that's key, that this is culture change and the social environment that we're addressing. It's not a program. It's the culture. So this is relevant to me because of all the prevention work that I do, and it's particularly relevant because last night I sat with a community meeting on underage drinking in Barrie, and I was with a group of teens who described their world now. They were asked about social media, and it dominates their lives. It shows them their peers using drugs, showing off using drugs, vaping, letting them know where locally they can get substances and alcohol, where's the party. And this is going on with them 24/7. This is peer pressure at a level that most of us never had to experience. And it normalizes activities that we'd probably rather not be normalized. So changing that reality is key. Along with working at CVNDC, Center for Vermont New Directions, for 20 years, I've also spent 15 years working on after-school and summer learning programs and with the Vermont After School organization. A piece of jargon that we're going to be using today is the third space. And just so that you're not wondering what the heck are they talking about when they talk about the third space, it's all the time in a youth's life that's not part of home or school. The first space for learning is the home. The second space for learning is the school. And the third space for learning is everything else. It's the largest space and the most underutilized. So productive use of the third space is one of the things that we'll be talking about. So I'll be monitoring the chat box as we go. Depending on what's going on in the chat box, we may either wait a while to address the chat, or if it's something that's relevant right now, I'll interrupt whoever's speaking and ask the question. The question box isn't going to be utilized, so everything goes into chat. I'll be checking it out and making sure that your questions get answered. And the polls are here to periodically find out what you're thinking, what you're wondering, and just take the temperature. And it's pretty exciting that we have this poll function because we'll get the results right away, which is unlike the YRBS. So I'm introducing poll number 1, and it's open. So we want to find out who's here. We're not going to do full-on noms, but we want to know. And you can, it says please select one, but I think you can select more than one if you play more than one role in this world. So who's here today? Are you with a prevention coalition? Are you a youth worker? Are you an administrator? Are you a health worker? Are you other?
Are we having trouble launching the poll?
No,
No, the poll is done.
yeah,
Oh, okay.
many people chimed
It's
in.
funny, I don't see it.
We had 40%
on the,
of the Prevention Coalition, 13% youth workers, 27% administrators, 7% health, and 13% other.
so a lot of prevention people, a lot of administrators, some health. And are we going to do poll number 2 now too? Yeah. So before we start, we want to know, what do you want? What do you want us to make sure that you get? Do you want a better understanding of the Icelandic model? Do you want a better understanding of the third space in positive youth development? Do you want inspiration? Do you want something else? And tell us what it is that you really are hoping. So go ahead and vote. And there's still time to vote. Looks like better understanding of the model is top at this point.
Great. So we had 95% voted. Great job. And better understanding of the Icelandic model, 76%. Understanding of third space and positive youth development, 52%. Inspiration, 52%. And 24% other.
Thank you for participating in the poll. So we put the slide of the YRBS in to give you a sense of what the data on this subject is in Vermont. You probably all know this, and this is a slide with an awful lot of information on it. But the trend of all the substances, and it was alcohol actually that launched Iceland on its journey, but we're looking at them. They're all going down, and this is under the spiff. They're all going down. But you'll see in a little while that Iceland went down a whole lot more and a whole lot faster, and we're going to think about why that is. So now Holly is going to take us to Iceland.
Thanks, Jenny, and hi, everybody. So this Iceland slide, and if you look at the rates, 20 years ago, they had 42% of their 16-year-olds drunk in the past 30 days, and driving those numbers down to a similar reduction around and cannabis. And I just want to say up front that I was somewhat skeptical about the Iceland model and looking at Iceland. I have been in love with the work in Finland and on what they were doing, and I was a little concerned that Iceland was too narrowly focused, or it was so too much overlap with stuff we were already doing. So I want to say that up front, but spending time there and really talking to the researchers changed my mind, and so I want to put that out to all of you to think about sort of these three things that come through, and one is this example or this promise of being able to do full-scale systems change in the society, and to have an example in our world where they've been able to do that is really uplifting and remarkable. We're going to talk about that. But then also always looking, like many of you out there, I'm sure, always looking for what can we steal, what can we take. And there are some real concrete tools and approaches and strategies in what they're doing that I do think can translate to Vermont and into our environment. And then the third thing that kind of won me over also was that the Iceland folks are not in this to make money. So this is not a program they developed that they're selling. They are researchers. It came out of the university where they were looking at data around young people. And that's really still where it sits. I mean, they've got global attention on their strategies, and they're trying to adjust to respond to the global demand for supports and understanding around what they're doing. But this really isn't this big money maker for them that they're trying to push out in any way. And just knowing that that like changed kind of my perspective as well. So I'm going to talk about a little bit those three things. I'm going to talk about that big picture, but then we're also, for that 76% who really want to know how the model works, we're going to drill down into some of the specifics. So Joel, and I can advance the slide, so if you could go to the next slide for me, that would be great. Awesome. So what you're looking at here is downtown Reykjavik about 20 years ago. This is a slide that they often show in Iceland in talking about their work. This is, they say, about 4 a.m., so in the summer, so it's still light out. And these are all young people as young as 13 or 14 years old, and they are drunk and they are high. And this was the accepted status quo in their society. And when you're there in Iceland and there's people middle-aged in the room, they can point to people in this slide that they know, and sometimes they can point to themselves. And it was just accepted. And it was seen sort of as the norm that as young as 13 or 14, Icelanders would start drinking, and that this is where everybody hung out in downtown Reykjavik. And looking at this, and when you look at a lot of the data across Europe, Iceland always showed up sort of in the worst categories for their teenagers, and they'll joke that they had, the worst teenagers in Europe, and now they're bragging that they have the best teenagers in Europe. I do want to say, in this culture change, that there's a couple of other things that you see in Iceland, that this is not the first time they've turned their whole society around. When you visit Iceland, it's very hard to find trees. It's really deforested. And that's another case where they looked at their environment and decided, instead of using wood and fossil fuels, we're going to switch, and now they're the leaders in geothermal power, as Ginny mentioned. I think another place is tourism. 10 years ago, they were on the verge of bankruptcy, took a look at that and said, we need to reinvent ourselves one more time. And now they're have this incredible level of tourism. 5 years ago, tourism, they had, I think, 500,000 tourists, and in the last year, they had 2.5 million tourists to Iceland. So I think they do have this in their culture, and it's what we're learning today is how they did this for their young people. If you go to the next slide, that'd be great. So where they are today. So when you're in Iceland, the feel is so different than that picture that we just saw of Reykjavik. They have, as in other places in Scandinavia, they have short school days. So they talk about young people getting out of school at about 1 o'clock or so. And they have set up this extensive system of sports centers and extracurricular activities across their municipalities. So say you're a parent in Iceland and your son or daughter gets out of school at 1, and a bus comes to the school and picks up your son or daughter and takes sports centers that are all coached by professional coaches. And they're physically active and playing and engaged for 2 or 3 hours. And at the end of the workday, you're able to pick them up and bring them home. And you've got a kid. If you go back up to the one before it, that'd be great. Yeah. You've got a kid who's, learned during the day and then had all this time to be physically active. And as we know about, positive youth development and physical development, keeping kids happy and active and engaged is a large part of health. Something else that you'll see is that at these sports centers, there are no waiting lists, there are no cuts. So unlike our systems here, where as early as middle school, you can get cut from the basketball team or the baseball team, or if you haven't been playing since you were 4 and part of travel teams and going to tournaments. The message that we're sending in many cases is that even though your body hasn't fully developed, you're not good enough to be on the team, and therefore you don't have access to the gym and the coaches and all those positive activities. The reverse is true in Iceland. So no cuts. What they do is they add more and more teams. So there's an A team, but there's also a B, a C, a D, an E, an F, whatever they need to do to accommodate all the young people. Also, all kinds of sports. Soccer is big. There's all these outdoor fields that they run the hot water underneath to keep them free of snow all winter long. And they've got all kinds of indoor arenas. And then they also stress the time with families. So as a parent in Iceland, there's a holiday coming up and there's a couple of days off of work and school, you get an email from the municipality that says, hey, hope you really enjoy your holiday. Remember, that's an important time to spend time with your kids. So this message around supporting kids, keeping them active, engaged, connected is really pervasive throughout the entire society. The connections also extend to parents connecting to one another. So they have built connections where parents have common agreements and common understandings of what is acceptable. So that as a parent of a 17-year-old, when I say, you really can't be out till 1 or 2 o'clock, but then there's, and my son says to me, yeah, but all my friends are, they've removed that piece of the debate, because if all the parents have the same agreement that everybody's in at 11 or whatever it is, then you're no longer having to have that battle. The same with substance use. As a parent in Vermont of a teenager, I have friends who have other teenagers, and some of them are letting them smoke marijuana, and some of them are growing marijuana with their teenagers. And having those different norms and understanding across society really makes it harder to parent, frankly. And Iceland has removed that by building that agreement across communities and across parents and families. So those are kind of the synopsis. I do want to also say, because sometimes there's pushback on the sports idea, the researchers did find that competitive team sports in their data, so remember, they are researchers, and their data, that showed the strongest outcomes in Iceland for reducing substance use, competitive sports teamwork. So that's really what they stress in their model. However, they have built into the system other types of activities in that out-of-school time, which they call the leisure zone or leisure time, which is outside of school and home, our third space. So in the cities of Reykjavik, for example, every parent for every young person has a leisure card, and it's the equivalent of about 400 euros. And you go on to an online system as a parent, and you type in your neighborhood and the age of your kid and the kind of things they're interested in, whether it's music or art or dance or sports, and all the approved providers of those extracurricular activities show up on a list, and you can sign your kid up, and you can apply your leisure card, 400 euros to the payment, and get them enrolled in the system. And in talking to parents in Iceland, a couple of things they say. Sometimes the leisure card doesn't cover the full cost, so to be a member of like one of those sports clubs, it's about 600 euro. So the 400 euro gets you most of the way there, but not all the way. But the other thing that they say is that if you don't spend that money on those activities in the leisure zone, you lose it. So it's a real incentive for parents to get into the system and get their sons and daughters signed up and engaged in playing. That's kind of what it feels like now. So what we saw 20 years ago to really how they've changed their society. And now we're going to go into some of the specifics of how their approach works. If you go to the next slide. The assumptions that they're making behind their approach is that adolescent behavior is a reflection of their social environment. So it's not that a young person wakes up one day and says, today is the day I'm going to try drugs. What they're saying, where those decisions happen is in a peer group at a party, and what's available and where that happens, whether it's in downtown Reykjavik or at a friend's house, really is a function of the society and the norms around them. Their second assumption behind their approach is that individual behavior is really difficult to change. They have other slides that they show where they are really strongly are saying, the key is not talking to teens about substance use and trying to coach them to say no and to fight peer pressure. These researchers behind this model had said, you're going against their development in their brains and they, the need they have to be accepted by peers, and it just doesn't make sense. So change the society. So substance is just not there. and really change the norm. You know, the norm that they have now in Iceland is that every young person will grow up substance free, and that is the assumption, and that is the goal. And then they also have this other one that the third assumption is that, and the acknowledgement that it took, you know, those high rates of use that they show at the beginning in that chart, you know, it took decades to get to that point, right? I mean, that was culture change over time to get to the point where that was the norm for downtown Reykjavik. And to acknowledge that the scope of the solution has to match the scope of the problem. So it was society-wide, and it took a long time to get there. So the solution needs to be society-wide, and we need to give enough time behind it to get to solve the problem. You can go to the next slide, please. They've really changed the focus on where they're focusing prevention efforts. So it's not just the cause of substance use. So we all know that young adults, young teenagers, you know, use substances, you know, when they have lack of purpose, they're bored, they're not connected, they're depressed, they're trying to fit in with peers, they're making poor choices. Like, we know that. If you go to the next slide, please. What they've really done in Iceland is they've moved that focus up to really talk about the causes of the causes. So what are the social and environmental risk and protective factors that create a situation where teenagers are bored, not connected, not engaged, not participating in school or making poor choices. So really focus on the things around them, not the choices that the individual teenagers are making, but the conditions that put them in those situations where they are making those choices. You can go to the next slide. The Iceland approach has these 4 domains that they focus on: family, peer group, school, and leisure time. And they place the individual at the center of it. Once again, they're not focusing on the individual, they're focusing on the domains around them. And what are the risk and protective factors in each of those domains that contribute to substance use? Family and parents is one of them, peer group, school climate, and then leisure time, once again, is that third, that time, school and family, and what's happening there. They also operate their strategies at multiple scales simultaneously. So they have strategies that operate within the local school community. They also have strategies at the municipal level, like the leisure card I talked about, or the email that comes from your municipality that says, hey, spend time with your kids, and also the national level. So they have buy-in on prevention and on this approach all the way up to the level of the president. And their former president has traveled to places like Chile to help Chile get their model going as well. So it's complete buy-in. You can go to the next slide. So here's what I mean by the risk and protective factors in these different domains. So in what they found from their research, so looking at, they have a survey that they do similar to IRBS, but instead of asking questions about only about what is your use, or have you been bullied, or do you feel safe, they also ask questions about how much time do you spend with your parents, what are you doing in the out of school time, and so they're getting at the protective factors, and then in the research what they've mapped is the protective factors to the rates of use. And then they've gone in with their strategies to create more, more protective factors for all students, all youth, and minimize the risk factors. So having friends that use drugs in your peer group is a risk factor. So how do we minimize that in society? Attending parties and spending downtown, spending time downtown in the evenings unsupervised was a risk factor. So in the Iceland model, one of the things they did was put a curfew. So there are no young people spending time downtown after 10 p.m. And I throw that as an example because their model is not to say everybody needs to have a 10 p.m. curfew. Their model is to say everybody needs this kind of data, and then you need to look in your specific community at what the risk and protective factors are that come to the forefront. Are the kids going home on a bus at 3 and then have nothing to do and they're bored? Are parents not spending enough time with young people? In the Iceland model, they talk about an hour a day with teenagers. And they'll even say it's not doesn't have to be like we're going to the museum to look at this great art. You can be hanging out in your living room and playing games or cards or whatever. It's being in the space and being with your young people. So you go to the next slide. This was we have numbers. I mean, Vermont After School, we care a lot about the third space and how much time, and I found it was fascinating. This was from one of the folks who works in the municipality in Reykjavik around the leisure card, and they had done a very similar study and of where youth spend their time in a typical year, and this is actually one of their slides. And what they found was young people were spending about 6% of their waking hours with their family. So, actively with their family, eating dinner or doing something. 14% of their waking hours were spent in the school day, and then 80% was spent in this leisure time, which really captures all that other space in the community, hanging out with friends, online, all those spaces. And what they've really done with this model is, as Jenny said, if you're only paying attention to family or school, if you're only sending all prevention efforts really, for instance, like through the school, you're missing out on this huge area of time and a whole other area of strategies that we can implement in Vermont. And this is one area where I really think that we can maximize and learn from their model. If you go to the next slide. So the core steps, so the nitty gritty. So for the 76%, I want to know how it works. There's really 4 categories of steps. It's building capacity in the community is where you start to really be ready to have conversations about youth. What is it like to be a young person in this community? The second area is around they have a very specific research-based, validated survey tool that asks questions of young people in the community that has those risk and protective factors as well as the substance use rates information in there. So collecting the data, looking at it, sharing it. The third area is really bringing parents and community members and municipal leaders and the sheriff and prevention network partners and business owners together to look at the data and think in each of those 4 domains that we talked about, where can we make changes in our community? Is it, instead of having a bus that leaves right at the end of the day, do we just have a late bus and we create activities so all young people are at school afterwards and hanging out and doing fun things? Or, do we need to really emphasize time spent with young people in our community and support parents in that way? What are the strategies that we can put in place? And then 4th is repetition. And if you go to the next slide, Joellen, please. It has a little bit more detail. So in that capacity building in the light aqua or whatever color it is, steps 1 through 3, this is really what's involved, is identifying who the coalition is in the community, where is funding going to come from, to build the capacity and getting ready to do the data collection. Then you move into steps 4 through 6, where you are collecting the data, you're doing the diagnostics, and you're bringing in community to look at the data, and you're disseminating the findings. And then 7 through 9 is where you're actually developing the strategies and putting them into place. And they're not, remember those 3 those 3 scales, right? There's local strategies, but there may also be policy implications that come out of the discussions, and you may need to be working on that as well. And then, step 9 is actually having young people moving through these steps, these changes in society, and the new environment that you're creating for them. A couple of things. Vermont After School has a signed MOU now with the Iceland researchers, and we're going to be looking at piloting the model in 5 Vermont communities starting late summer, early fall. Because I'm very curious to see, how these steps look. Now, when signing an MOU with Iceland, they require you to sign at least a 5-year MOU. Because remember about the scale and the scope. What their results came over 20 years, and you really need to be on board for 5, 10, 15 years to really see the kind of changes that we want to see. So we're starting with the 5 years. And then the idea is that you don't fix everything the first year with the community. When you look at your results, so they'll share the data tool with the communities that we're working with. The communities will have the students in the middle and high school fill out the data tool. The data will go to Iceland. They will do the analysis, and they will start to do some of the identification of where those, what the risk factors and protective factors are in those specific communities. And then that comes back to the communities in those meetings. And it's up to the communities to look at that data and to figure out what strategies are going to work. And they say, the Iceland folks say, you know, they've got a list. They've done this in a number of countries. They've got a list of, you know, 200, 300 strategies for the different domains that they've seen work in other places, but they wait to pull that out and let the community really start to find their own strategies first. And if they get stuck, they might pull out this sheet just with some ideas, but it's really about finding what's going to work and what's doable and picking what can you work on the first year, what can you work on the second year, what can you work on the third year, and so forth. If you have the next slide. Here's an example of some of the data that's in the tool. So we've talked about this. One of the things that they're asking about is how much time parents and children are spending together. And this goes from 97 to 2018 in Iceland, the increase in the percent of students that are children that are spending time with their parents. If you go to the next one, please. This is something else they've tracked, right? It's the participation in organized sports. So 20 years ago, they only had 23% of young people. Now they have 43%. And they've even done data around like how many days per week make sense. And one of the things they say, you know, most kids are spending a couple days a week in whatever sport they've done. The more competitive ones are maybe 4 days a week. They found after 4 days a week, you don't really get that much more benefit in their model. And if you go beyond 5 days, you actually start to see a decline, which, you know, kind of fits with what we know about kids getting overprogrammed as well. So the next one. This is being unsupervised, so out late, and how they've changed sort of that culture too. So their teenagers are not out late, and they have other questions about unsupervised. Do your parents know where you are? Are parents checking in? All kinds of things like that. So these are just a few of the examples. Go to the next slide. So all of those together combine to get the kind of results that we see in this overall chart. And I do want to also say, if you go to the next slide, I threw in a couple of examples of there's other ways to measure. This is another slide that they show. So not only do you see the decreases in substance use over the last 20 years among Icelandic youth, this was a study of 2009 Nordic Youth Study, and that circle around the purple line, so the purple line is the Iceland line, and this is onset of when you first take your first drink as a young person in these different nations. And this has been really a lot of, really Iceland's approach has been to delay the onset, so that, and it really ties to right brain development. So not having kids drinking at 13 and 14, but how do we push that back? And they show this as one of their data points to show that they have been able to delay that onset. And the later that kids wait before they try anything, the less likely they are to use. If you go to the next one, please. Their study really, and the researchers are very careful to say that their focus has been on substance use, but they do see some other results. So I threw in a couple of slides around that. It was interesting. They were, as researchers, they didn't want to promise more than what they've seen in their research and what the model could deliver. So they were very specific to, these are the kinds of things we've measured. But at the same time, in talking about it, there are a number of times where they would say, you know, you almost don't even need to mention substance use. It's really about creating a positive environment for any kid to grow up in. So this one I threw in where they've also seen these decreases in bullying. And the next one, Joellen, please. around theft has also gone down. So as we know, prevention is prevention is prevention. And if you're doing prevention well and you're supporting positive youth development, then you're going to see it across a number of different areas. If you go to the next one. So key differences really is matching the scope and giving themselves enough time. This is not an 8-week program where you're working with a subset of 20 kids on some kind of specific program or curricula. This is really about treating the entire environment, not just the individuals. They say, society's the patient, not the kids. Society's the patient. We have to treat society. It's sustained attention as treatment. It's also making meaningful connection. So they'll also say the opposite of prevention is connection. So if our kids are connected and heard and engaged, they're going to be less likely to use. It aligns community and professional activity as a treatment, and it builds specifically on the community's capacity for leadership and problem solving. So once again, they're not delivering strategies and a recipe for exactly what to do in each community, but rather it's a data tool and an approach. I just really want to be clear on that. And then they have the powerful and positive outcomes to show over a 20-year period. Go to the next one, please. I can't not mention Finland as well. Finland's approach, I just want to throw in here for a minute, because we're seeing, as we're trying to build a Vermont model here, some sort of fundamental truths that seem to be coming out of Finland as well. So in Finland, they also have the shortest school day, highest test scores, so a lot of third space, and they have done very similar to Iceland, a ton of investment in the third space. In Finland, it's not sports centers, it's youth centers. So it's youth centers that are filled with like musical video recording studios and theaters and costume areas and professional graffiti artists, and one of their national indicators that they have adopted in Finland is that every young person in Finland will have a hobby. And when you press them on that, it's not about someone sitting in a room collecting stamps. It's really about young people having autonomy, a self-awareness to know what they're interested in, autonomy to figure out what they want to do and where they're going to go and how to get to band practice or basketball practice or whatever it is, and having those social connections with other peers and adult role models, and really being part of society. So just that one measure of hobby really helps to drive culture change. And I think that that's one of the connections back to Iceland, right, is having certain measures and certain data that you're looking at can help to drive your culture change. I think for both of the countries as well, their work is grounded in youth rights and youth law. In Iceland, it's the right for young people to grow up substance-free, so let's create a society that supports that. In Finland, it is the right to be involved in decisions that affect you. It is the right to have activities and hobbies. It is the right to have social connections, which really changes the conversations in those countries. Also, youth voice at every level. Youth voice looks different in the two countries. It's very intentional and very strong in Finland. They have youth councils that control budgets and big money and sit on boards at all levels of government. In Iceland, youth voice really comes in these surveys and how they're listening to their young people. So different approaches to youth voice. The pyramid, most people will be familiar with. We have youth, you always have youth in crisis who are addicted or in the system. You'll have youth who are at risk. And then you have all youth at the bottom of the pyramid. And across Europe, the countries who have continued to invest in the bottom of the pyramid and changing what it is like to be young in those countries and those societies for all young people, not just those at risk or at crisis, have had the strongest results. The countries, Denmark, Netherlands, that have cut investments to the bottom of that pyramid as a way to save money have actually resulted in increasing the number of youth at risk and in crisis, which of course is more costly to serve. So some big lessons learned from that. If you go to the next slide. And I will pass back to Jenny. Unless, Jenny, are there any questions in the chat that you want me to pause for?
Not right now. Some people are putting questions in the question, and I'm having a little trouble accessing them. So let me figure out how to get those out. But right now, let's go to poll numbers 3 and 4. And poll question number 3 is, while some communities in Vermont do show positive outcomes, the overall picture is dramatically different. Think of that plunging graph. What do you think makes the difference? Is it a different implementation, different demographics, emphasis on the third space, not school or home? Is it community parent involvement, or is it funding? What's your best guess on what's making the difference? And that poll is open right now.
Okay, so we had the results from that poll. 36% different implementations. At 21%, we have different demographics. At 43%, emphasis on third space activities. 64% community and parent involvement, and 36% funding. Great job.
So we may want to talk sometime about that community parent involvement and how we can do that. Our event we put on in Barrie had 3 community members, and everybody else was sort of an insider. So it's tough to do. All right, poll number 4. Iceland emphasizes sports in the third space. Finland uses the youth voice and hobby approach. Where do you think Vermont should lean? With the sports centers, with the leisure centers, with the teen centers and hobbies and arts, with a combination, or something else? What do you think? Go vote.
Okay, great. So the results, 85% combination, 10% teen centers, hobby arts, and 5% other.
Great, thank you.
And I do have access to the question, so I will read the one that I see. And this is posed, how do you see the Iceland model dovetailing with RISE Vermont? That's a pretty specific question.
Yeah, it's a great question. I actually think the Iceland model dovetails nicely with RISE Vermont. I think it dovetails nicely, or could, with building flourishing communities in that model, as well as efforts with the existing prevention networks to involve communities. You know, the Iceland, even the term model, I mean, I keep using that term too, and remember, it's an approach, right? It's a data tool that I think actually that point about getting community and parent engagement, I think that's one of the things that their data tool has done, and their community building, their community meetings, because their data tool, like in speaking with West Virginia, who's using their data tool, they'll do the survey with students in December, and 2 or 3 months later they have the data back. So it's more real time, so it's easier to pull parents in because you're actually talking about their kids. You're not talking about their kids 2 years ago, which sometimes happens with the YRBS data, or even 18 months ago. It's real time in the same school year kind of data. So, and it also points to not just what the rates are, but those protective factors, which gives people a sense of, oh, we can do something, right? Because you've identified protective and risk factors, so there's something to do. It's not just giving them data and saying, oh, 23% of our kids are smoking marijuana. You know, what do we do? Like, it has that next layer. So I really think it's a tool that these different groups. And I don't think we want to create yet another thing. I think that I know in the communities that we're going to work with, we're trying to layer into already existing efforts. And you know, one of the things that Iceland also does is, remember, as everybody's pulled together with the same message, right? So part of that capacity building is to figure out, well, where's the Rise Vermont? Who's doing building flourishing communities? Where's the prevention network? Where's the after-school provider? Where's the school? And pulling them together and using the data and the strategies as the common thing that you're coming together around. So I really don't think it needs to be another layer. I think it needs to incorporate within it. And so a place that has Rise Vermont, right, already has maybe some of those community members identified in a process in place, and maybe has some funding to start that could go to some of the strategies if that's what comes out of it. So I think there's some really nice connections in that.
Holly, we have another question for you, and that is, what communities are you working with in Vermont to implement the Icelandic model?
We're still in the process of identifying those and working with the Department of Health and the Agency of Human Services. If you have a community that is ready and would be willing to sign a 5-year MOA with us, you know, please feel free to email me, and let's have a conversation. I think you've got to have a community that has the potential, at least in the first round, to like the ones that have been identified that it looks like they're going to move forward, you know, are ready to move in the fall around the data collection. So you need, you know, that school buy-in to do the survey. You need those structures in place. We can help with pulling everybody together, but you need to have that kind of, be ready for that kind of move. But I'd be glad to talk further with anyone.
Okay.
And there's another question here that says that on their screen they don't have a chat box. There's just the question box. So we'll have to start monitoring that more closely.
That's fine.
And there was another question about sometimes sports in this country are more of a risk factor. What is Iceland doing differently to make sports more of a protective factor?
Oh, I'm so glad somebody asked that. Because it is true. You know, our sports teams can be that risk factor. So there's a few things that they're doing. And one is that they have only professional coaches coaching these teams. So they are not parent volunteers. They are not, you know, the man or woman who played in high school who's, you know, out there sort of volunteering to do it or whatever it is. They are professionals. So we saw one team where they had 3 coaches. I think this is a boys handball team that we saw, one of their top teams. One had a master's in sports physiology. One had a bachelor's in education and a master's in another division of sports or physical therapy or something like that. And then the third, I think, also had a bachelor's in education. So it's this common sort of education, high-level educated youth worker, which is also in the Finland model. So in Finland, a youth worker has to have a bachelor's, you can get a master's or a PhD, and you are a specialist youth young people. So that's one thing. So it's really trained people in the field. The second thing that they do is that in order to be part of the leisure zone and be an accepted sports facility, you have to meet program quality standards, essentially, that are set by the municipality, and they're always following up on that. And there's real incentives, and this is for a private provider as well. So if there were like a karate place that wanted to get in, they would have to meet these standards in order to be listed in that leisure zone database, that they are supporting youth and that it does show up as a protective factor and not a risk factor in the data analysis that they're doing of young people in that community. So they're definitely paying attention to that.
Question for Joellen. Will the webinar be available at the CHL website when it's over?
Yes, it will. Give us a day to get it up, and we'll have that up. We can send a follow-up email to participants to give them the link to that. We do have a couple more questions. A comment from one of our researchers in the audience. First, I just want to mention all I said here. Earlier, it was indicated that Vermont results are dramatically different than Iceland. However, we have similar downward trends over the past 2 decades in youth alcohol use, and more recent downward trends in prescription drug misuse. So yes, we are absolutely making progress in Vermont, and we want to continue to build on the work, which is very much aligned to the work that Iceland is doing through our community prevention work, where that's active in communities. And I'm going to talk in just a moment about some of my key takeaways as somebody who's been doing prevention in Vermont for the last couple of decades. I was invited to attend this conference and I just jumped right on it because when you spend time doing something, you want to do it as well as you can possibly do it. And I went also curious and found that there were some differences that I thought we could apply in Vermont. I'm going to share those now. And before I do, I'm going to share another comment from somebody in the audience. Iceland also has a very different community norms that support youth to make healthy choices, re-substances. They do now, and that's something we really learned about. Those norms weren't there 20 years ago, 10 years ago. They've been slowly changing. They do not allow any advertising of alcohol or tobacco and limit outlet density. This is true, and those strategies are strategies that we're working on in Vermont as well, and that they really prioritized and focused in Iceland. The existing community infrastructure supports prevention and healthy choices. So I'm going to just share a few of my key takeaways as somebody who is really new to this arena, and I think Holly just did a very thorough job providing some of the research background, and I'm going to just highlight some of those in terms of my key takeaways from the conference. The first was that Iceland has made a very concerted effort to put research, policymakers, governmental officials, leadership, and people who do practice and program together. I'm going to use the expression in the same room to work very closely and continually. So the research and data people are not over here in one place collecting the data and just putting it on a website and reporting, but they're actually interfacing with the people in the communities and the preventionists and the parents as well, and really discussing so that they can stay focused on common goals and outcomes. And this goes on, as you saw in the model that or the steps that Holly presented earlier, repeatedly and consistently annually in a very concerted way. The mayor of Reykjavik kind of summed it up, I thought, when he kicked the conference off and he said, we decided to stop trying to fix the kids and we decided to fix society. And that required having research and data and surveillance, people who make policy, governmental legislators, and community influencers, and those who carry out the program together. And they focused on the principles that the society would value. They agreed to change the lifestyle environment of children to influence their behaviors. And as Holly mentioned earlier, they shifted from an individual level of change, trying to fix the kids, to a societal level of change, changing the norms in the environment. They really focused on community building, and they defined community building as increasing opportunities for positive relationships between youth and their families and their schools and their communities, and for ensuring how they spend their time. One of the things I wanted to address, because I went with this attitude, I think we're a little different here. We all have a tendency to think that where we live or the communities we work in are a little bit different. I was reminded that Iceland was different too, and they brought their use down through the strategies we're discussing as we can. Iceland does use a very data-driven approach, tracking trends within and across towns, municipalities, and regions. However, what they've done is cross-tabulated data across regions and continents. And what they found, because they're working in many countries now, and what they found is the results are the same. Risk factors are risk factors, and protective factors are protective factors. And when you strategically gear your resources to build the protective factors, the impact of the risk factors declines. Again, I mentioned earlier this sustained dialogue really impressed me between key stakeholders, that is very critical. Politicians, municipalities, decision makers in local authorities, parental groups, school authorities and staff are very engaged, school leadership, health educators and healthcare social services, prevention workers, and then the leisure time workers, sports and youth leaders, and nonprofit organizations. So everybody is engaged with the same goals consistently that they've arrived at by looking at the data and focusing on the same outcomes, delaying use and increasing positive connections. Again, they've really focused on strengthening the relationship between families and schools, and not just kids and families and kids and schools, but families and schools. The connection between life at school and home is very important and has become a societal norm. They continue to educate parents that it doesn't make sense for a 15-year-old to be drinking at all, and even if they did it when they were young, that there are many risks involved. By educating and informing parents about the data consistently, they gradually shifted the attitudes and behaviors of families and parents. One of our tour guides has a 9-year-old, and I asked her how much she works, and she said when he was born, she was working quite a bit. But now one parent tries to keep their work hours to less than full-time, part-time, and to make sure there's always a parent available to the kids. And that was without me soliciting any particular input, just asking the question. So she was reflecting this norm about the value between parent connection and family connection, or adult connection and youth. The researchers were also very clear that you don't have to have all parents in a community engaged directly, that having enough of them creates the culture change that ultimately affects everyone. The government of Iceland supported families in keeping youth engaged and created a new norm. Time off from school is family time, and they support that by providing grants to municipalities and nonprofit organizations and other partner organizations to plan positive youth activities available to all. One of the very first things that the governor said to the delegation was that they recognize that a competitive grant-based system is not a viable system of prevention. Prevention programs are commonly siloed and often outcome specific. They described that previously professionals were working from one grant to the next with no secure or sometimes viable means of sustainability. So Iceland shifted this approach and began appropriating funding to support prevention staff and communities. All coaches are paid, not volunteer, and there are quality standards, and local towns and families receive leisure time incentive funding. So building a sustainable system has the effect of ensuring that community stakeholders stay involved, and that really, the light went off for me in that regard, that the perception of everybody, if prevention funding comes and goes, is that it really is not a main priority. So that one of the outcomes of building a sustainable system is the effect of ensuring community involvement. The Iceland work is built on leveraging the different roles we spoke about earlier, researchers providing timely data so stakeholders can track outcomes, and engaging the school leadership and parents as primary to establishing the positive connections to schools and within and between families. They encouraged families to talk to one another, to check in, to communicate about the where and whatabouts of their children. Everyone was very focused on the same outcomes and goals: delay initiation and use, surround youth with positive connections at school, home, and in the community. They recognized the connection between mental, emotional, and physical health, and that keeping kids active in leisure and competitive sports lowers blood pressure, obesity, diabetes, and keeps the endorphin levels naturally high, conditioning a climate of positive mental health and offsetting many of the problems we see associated with depression. I'm going to turn it back over to Holly.
This is just a fun slide we have in there. So you can't go to Iceland without them bragging about their soccer team and beating England recently in the World Cup. And one of the points, though, that they make in all seriousness is that these athletes that are competing now on the world stage are really some of the first, if you think 20 years with this system in place, and some of the first to be growing up in this new society, in this new environment that they've created. And they point to the soccer team, they point to a lot of others as well, but just how, changing that environment really has also made them competitive on the world stage. And they do love their soccer team. I think we can go to the next slide, I think is.
So we have another poll number 5 and 6. Poll 5 says, where do you envision a leadership role in a comprehensive youth model such as this Icelandic model? Who's going to drive the ship? Is it the schools, the coalitions and community organizations, after school and youth centers, town, state policy, or a combination of the above? And if you have an idea about what combination of what, put it into the question box. Poll is open.
Okay, great. We had 75% vote, and the results, 22% coalitions and community organizations, 6% after school and youth centers, 11% towns and state policy, and 61% a combination of these factors, including schools.
So we would love to hear more about your thoughts about a combination. And poll number 6.
While you're launching poll number 6, we have a question about what the drinking age is in Iceland.
I don't know. Does anybody on the panel know?
Seems like a basic question.
I can search it in a sec.
Okay.
I think it's 20.
20?
I think so.
Okay. Well, while we're looking that up, think about what the greatest challenges are in implementing a youth model similar to the Icelandic model in Vermont. Is it the hardest thing going to be engaging parents, engaging youth, engaging community support, funding and sustainability, or evaluation? What do you think? The greatest challenge.
And here are the results. 17% engaging parents, 22% engaging community support, 50% funding and sustainability, and 11% evaluation. from.
Thank you for that information.
The drinking age in Iceland is 20.
And it's encouraging to see that nobody thinks that engaging youth is going to be hard. So, yay.
And somebody has offered that I think this means that one of the challenges is funding and technical support around data collection and an analysis.
Mm-hmm. Mm-hmm.
Yes, and I think those of us who went, we're thinking a lot about that. Somebody else has said, in my community, there's a high percentage of single parents living in poverty. Engaging them to be more active for their kids is a challenge when they are struggling so much.
That's a great point. One of the things that they talked about in Iceland is that you won't get every parent, and actually their research has shown that you don't have to have every parent. You need enough of the parent. So the thinking is, you know, if my parent isn't engaged for whatever reason, but I'm hanging out with 3 or 4 friends and their parents all are, that I'm going to get, what they found is that I will get some of that benefit, right? Because the norms will be different for all my friends. So even if I don't have a curfew, I'm not going to have anybody to hang out with. Or, you know, those parents are also, you know, going to know who I am, and I'm, you know, still going to have, you know, access to the coaching and some of the systems that they have in place and so forth. So it was a realistic look that there are, you know, some real challenges for some families, but that still, if they found that if you had enough in a community, and then they've also found, like in West Virginia, that maybe it's in some communities it started small with just like the typical ones that you expect are going to show up in the community, but then as things started to happen, the numbers, you know, have grown and more people have become involved.
Another question from the audience. The list of engaged partners excluded local businesses. Any comment?
Well, that's interesting. I do think businesses are involved. Do you have any further comment on that, Holly?
Yeah, I think businesses are involved. I mean, I think, you know, there are differences in their society. I mean, the first one that I would point to, this doesn't get to the business thing quite yet, though, is that the school and the municipality are one, right? So we have, you know, the local control and the school systems, and the municipalities or town governments are separate. So there are things that are different there. But businesses are part of the model. You know, businesses are delivering some of the services in the leisure time. Businesses are part of the discussions around marketing and where alcohol and other things are allowed to be sold. You know, it is, you know, it is really, you know, integral, and at those 3 scales: local, municipal, and national.
And sometimes it's individual businesses. Sometimes it could be like the Chamber of Commerce or some sort of a more generic group. But it's really critical. I agree that we make sure that businesses are involved in this because they have a stake in it.
Somebody has asked what the status is of marijuana in Iceland.
They mean like well,
they are tracking marijuana use, and I know that they're concerned about it and focusing attention on it.
Yeah, and they're very, I mean, the Iceland researchers are actually very humble, I found, and there's things that they're saying that they are worried about. They're worried about teenage girls and self-esteem. They're really looking at social media and the high use of phones and cyberbullying and you know, that aspect of being young. So they're not saying they've solved everything, you know, but there are some things that they're figuring out, and they, from my understanding, is they're the same kind of approaches is what they plan to use. But they are tracking marijuana for sure.
Here's a question that gets at that demographics that we highlighted on an earlier poll. What do you know the percentage of single-parent families versus the rate in the U.S.?
I don't know that off the top of my head, but we could look that up, and maybe in the follow-up email, Joellen could get that out to folks. I've gotten, in doing these presentations in other places, I've also gotten questions about not just ethnic and racial diversity, but also socioeconomic diversity and how Iceland compares. And they do have some diversity. They do have, when they look at their data, they do see that kids of new immigrant families are, how to express it, showing higher substance use or lower results, or however you want to express that. So that is on their radar screen, just something to focus on. And there are, of course, like I just talked about some of the other differences. I just want to make sure in our conversations that we don't let the differences allow us to sort of say, well, it'll never work, or we can't, I mean, I really, really strongly believe that there are things that we can take and we're going to have to tweak. And that's why also, partly, Jenny and I threw in some of the Finland stuff as well, to just be really clear that we're not trying to turn around and become Iceland and Vermont, overnight. But what we're trying to do is to take what they found to have worked and to use it here, and building on the strengths that we already have in place.
So we have about 10 minutes left in this webinar, or even less. So we should move along. Thank everybody for their participation. Holly, I'll turn it over to you.
Yeah, this slide is just to summarize some of the things that I think, as we're starting to build a Vermont model, that need to be in there as some of the essential components when you look not just at Iceland, but at other places around the world and in the U.S., and how we can raise up some of these things like youth rights and treating the environment, training our field of professionals so that we're not creating more time and leisure time that is actually a risk factor. Those need to be protective factors and so forth. This photo was selected very intentionally. This is a Vermont photo. One of the things that we do, and I was just at a college graduation where this was done, is we celebrate the young person who swims upstream against all odds and beats those odds and succeeds. We talk about that a lot, and we celebrate that. So, their parent was addicted or was incarcerated, or they had no money, or their house burned down, or whatever the story is. And despite all that, they made the odds. They beat the odds. And really, the big message coming out of Iceland is it's not about celebrating the young person who swims upstream. It's actually about changing the current of that stream, so that any young person that jumps into that water is able to go with the flow, right? Everybody is substance free in my community. Everybody's doing things in the out of school time. Everybody, is spending time with adult role models and parents, and everybody has access to these things, and that's the norm. So it's really about changing the flow of the stream, and I do think that is a message that we together, all of us on this webinar and beyond, can sort of spread that message. You go to the next slide. And it really is about changing, right? So prevention just is not about substance use, right? Prevention is about being a young person in Vermont who's able to manage your emotions, connect with other people, find meaning and enjoyment in life, be active, engaged, and have a voice. So those polls where we talked about we need a combination of strategies, whether it's youth centers or arts or parent engagement or whatever it is, making sure that our young people are connected, engaged, active, and heard, is really the key, right, to prevention society-wide. Can you go to the next one? Some things are really, really hard, right? Like someone already brought it up, like generational poverty is really, really hard. Curing addiction is really, really hard. Economic development in our little, tiny, small towns where we're losing young people, like that is a hard issue. I would argue that creating programming and opportunities for youth to be active, engaged, connected, and heard is doable. Like to me, that sounds like something that we as a state can take a big bite out of and do. Like that feels doable and will help connect back to some of those harder issues. Can you go to the next one? Vermont communities are ready. So I don't know if everyone knows, but last year with the tobacco settlement funds, there was $600,000 that was set aside by the legislature and the Agency of Human Services for increasing access to after-school summer programs in that third space. So paying attention to that leisure zone as a prevention mechanism. So it was $600,000. It was meant to be spent about $300,000 a year for 2 years. There was an open competition this past spring. We received proposals totaling over $3 million for 1 year alone. And for when you include proposals that were requesting 2 years of funding, it was $5.5 million in requests for that $60,000 that we had to start. So it shows two things. One, as our poll showed, funding and sustainability, is a need. So we need to be putting more money into prevention. But it also shows that communities are ready. I mean, we have proposals coming from every county, from all kinds of towns, places we had to look up, from not just schools and after school and teen centers, but from homeless shelters and from summer programs and from other initiatives working with kids with challenges. And it was really, really inspiring to see the level of readiness. So I wanted to mention that here, because many of you are working in prevention networks and in places, just so you know that level of readiness is there, and so how to connect and how to take advantage of that. Next slide, I think.
So we're at the end of the webinar. We do want to see if we can share with one another what some of our takeaways are in listening and thinking about this. We also want to thank each of you for the work you do. You wouldn't be on this webinar if you weren't a concerned Vermonter in some role, whether it's research and data, policy, practice, school work, community work, social services, etc. So thank you for thinking with us about this. We're interested in your feedback. Again, please stay on when this closes so that you can provide us some evaluation. And if you could use your chat box, if you'd like, if you don't see a chat box, use your question box. Tell us, what is your takeaway?
Somebody just said, I particularly like the emphasis on fixing society versus fixing kids. This is something we have been working on in Vermont for a while, but the language they use is clear and helpful. I also think the emphasis on sustainable funding is critical.
Somebody else said, this is exciting as our community coalitions already do so much of this work in Vermont. Look forward to finding ways to promote and expand the work already being done.
And Lori, we will find out the marijuana situation in Iceland and let you know.
It is not legal in Iceland, and in fact, it says that this is April 20th, so a recent post. The laws are strict even concerning medical marijuana, but that's a very quick response. I don't know a great deal about it. Let's see, any other comments or questions?
I'm very interested in working collaboratively with other prevention coalitions to build momentum for this model in Vermont. Thanks, Mariah.
Great. I appreciate hearing, let's not look at differences and say it will never work here. Instead, we can integrate into what we have in place already. Doable.
Working together is key. Let's not create another thing. Weaving all our efforts together is valuable.
Thank you, Joelle and Ginny and Holly. You're welcome. And thanks to Prevention Works for thinking of this and inviting us to produce it. Somebody else said, I look forward to connecting with my community to work on connecting with kids and helping make the quality of life better. What a great way to end this webinar. Thank you all very much. It's 12 o'clock. We're going to sign off. Please stay in touch, and the evaluation will pop up in a moment.